Welcome to the Greater Winter Haven Chamber of Commerce Ask the Doctor series. This series is being done in partnership with Baycare's Winter Haven Hospital to give you, the community, an opportunity to learn more about our local physicians, as well as the important services that Winter Haven Hospital provides to keep our community healthy and thriving. On today's episode, we have the honor to speak to Dr. Robert Atkins. Dr. Atkins is board certified in family medicine and serves as a physician with Winter Haven's Family Health Center. On this episode, we learn a little bit about Dr. Atkins' unique journey to the medical field, as well as the services provided at the Family Health Center. And since June is Men's Health Awareness Month, we speak about the most common concerns for men's health. Thank you so much for taking the time to come on the show today and give us a chance to speak to you a little bit more about family medicine. But I like to start not focusing on necessarily your practice in family medicine, but to learn a little bit more about you and give the community an opportunity to learn a little bit more about your journey to Winter Haven. So can you share a little bit of that with our community?
It's a pleasure to be here, and it's an honor to have an opportunity to sit here and talk to you all about Winter Haven, a little bit about what goes on here at the Family Medicine Center. But yeah, I am a family physician. I was originally born and grown up and raised up, as we say back then, in Eastern Kentucky in the coal fields. So I was there for many, many years. And medicine is actually a second career for me. I was in the coal industry for about 20 years as an engineer, and worked there in Eastern Kentucky among the population, being from there. Then after about 20 years in engineering, decided that medicine was where I really was supposed to have gone anywhere. And as 21-year-olds who come out of college sometimes think they know everything, right? I thought I knew everything at 21 and thought for sure that this is what I needed to do. But by the time I got to my mid-40s, I realized, well, maybe it wasn't quite exactly, I wasn't as smart as I thought I was. So I was able to go back to medical school in my mid-40s and then graduated, did my training at the University of Kentucky and did my residency with their rural program, which is in Eastern Kentucky, primarily doing medicine for underserved areas, which is where I'm from, large poverty area, large area with very strong chronic diseases, COPD, hypertension, diabetes, very high prevalence is there. So trained there, went to open my own office for a little while in Eastern Kentucky, and then went to work, thought maybe I could do a little bit better with influencing the healthcare of the region by going to work for the University of Kentucky and became their director of family medicine residency program in their rural tract, training physicians to specialize going to areas that don't have the physicians that need to deal with chronic care, that don't always have specialists, but can provide the care that everyone deserves there. So did that for a lot of years. And then last year met Dr. Falk here at the Family Medicine Center with Florida State, and knew that this was a brand new residency program starting from scratch. And thought this was be a wonderful fit. Talked to him about what his vision was here for family medicine and what the vision was for Baycare to reach out into the community and the population here. And he sold me. It came to Winter Haven. That drew me here. It's a population that has some similarities to where I was from. Some chronic diseases, some advanced state chronic diseases. This population is very diverse. So seeing that, having the opportunity to come in and train new physicians to go out and hopefully stay in these rural areas is really, being from a rural area really touches my heart, and I want to be a part of that so that we can have the next generation treating people that may be not necessarily easy access to a Tampa or to an Orlando, but somewhere in the more of the rural areas that can have good health care also.
Well, that's fascinating. One, that your career as a doctor was a decision made in your 40s. You don't hear that very often, that kind of mid-doctor career change, because of certainly the amount of education and the number of years you're committing when you decide to make that pivot. But also that Dr. Falk is such a good salesperson as well for our area is very exciting.
He is. He's a very, very good salesperson, but he's one of those that he exudes integrity too. And that was one of the things that's so important. And I think Baycare does that also. They're an organization with some integrity. In a culture sometimes that integrity is lacking, and we all miss sometimes. But I think both but Dr. Falk does. He exudes that vision and that integrity to say, yeah, I want to be involved and be part of the community and make things better for the general public that I'm involved with. So yes.
So one of the things, as you mentioned, Baycare is very good about doing a needs analysis, looking at what not just the needs of the community are at this very moment in time, but what they're going to be over the next 5 years, over the next 10 years. And so the program that you're involved in really came out of that needs analysis, which was the need to access primary care in our community and in Polk County, really Central Florida in general, but certainly in Polk County, Hardy, Highlands, those areas that are slightly more rural, and where you see a number of people present at, for example, they're using the ER as their primary care physician.
Exactly.
And so out of that came both the wonderful program of the family medicine residency program, which is great because it brings young, fresh doctors to the area. We get to sell them on the community and how wonderful it is to be in Winter Haven, but at the same time, they get to learn through this process with the family health center. So tell us a little bit about how that works, the family health center and the program itself.
Yeah, the program itself is a residency, family medicine residency training program. And what we do is each year take a number of new graduated physicians, new doctors, and we take 6 every year. And so they go through a 3-year process of training where each of these physicians are exposed to different aspects of family medicine, whether it's OB, they learn how to deliver babies and what to do with obstetrics. They learn with wound care, how to take care of wounds. They go through surgery training, how to do minor surgeries. They learn how to take care of pediatrics, children ages 0, newborns, all the way to 18 years old. So what family medicine is really about is kind of this holistic, whole family care from cradle to grave, you probably heard. So each year we take 6 new residents that we pick. We've interviewed out of, I think there were almost 2,000 applicants for 6 spots this year. So out of all those, Dr. Falk goes through, the faculty goes through and looks at who would be a good fit, who fit the mission of Baycare, Florida State. And part of that mission too is that we want physicians that have a heart for rural areas, that have a desire to come into an area and provide care to some individuals that may not have had adequate care. So we look through those applications, go into this fancy thing called the match, which is run through a national organization, and come up with residents, new physicians that we train for 3 years. So last year was our first year, which we have 6 residents that will be completing their first year in June 30th. Our second year of 6 will begin July 1st. So starting July 1st, we'll have 12 residents here, 12 physicians, actually, they're fully licensed physicians that we train for that 3-year period. And then after that 3-year period, after they've been exposed to all of the training that's involved with family medicine, they move on, they complete the training, and they're fully licensed and being able to go out into the community and have their own practice or join an established practice and provide the care here.
Yes, and here being the operative word. We want them to stay in Polk County, right?
It really is. That's when I was at the University of Kentucky in the rural program, one of our primary objectives was to find people that wanted to do medicine in rural areas and stay. That's what attracted me here, was that Dr. Falk talked about, and Baycare's mission is that find physicians that have a tie here, that have a heart here, that will stay and provide that long-term care. And just a little bit more about my background. Because I grew up in Eastern Kentucky, and we had very little health care. In fact, the first hospital that was there was called the Miners Hospital that came out of the UMWA wars. But That's, but that was part of it. But what happened is that over the years, because it was such a rural area, we would only have physicians that would stay for 2 or 3 years and then transfer out. So there was not any real good continuity of care for families for long-term care. So one of the emphases that is here, and I'm sure the same things happened, is that physicians will come but won't stay. But what we want to do is try to get them here, get them established, let them see what is available here, the things to do here, how nice a place it is to live, the activities, and it's good for a family. It's good to establish a family, and so they stay long-term to provide that long-term care for the patients that are here.
Absolutely. So what can a patient expect at the Family Health Center? What's a typical day in the life at the Family Health Center?
Well, a patient, hopefully what we want them is that they will be able to come into the physician center here, the family center here, and that they'll be welcomed, number one, and that they'll meet people that care about them as individuals, care about their health concerns, and then be able to adequately address those health concerns so that their health will be better than it was when they walked in, or that we can team with them or establish a partnership with the patients so that the care, the advice we give makes their next 20 years, 50 years, 80 years, whatever that may be, even better. So when they walk in, the first thing we want them to feel is that this can be home, not just for them, but for their family. But they'd come in and they'd be welcomed by the front staff and, do their normal paperwork, which is always everywhere. You can't go anywhere without doing paperwork anymore. But then be escorted back to an exam room and meet one of the physicians that they might not have been able to meet, but one that's already looked at some of the information about their history and have some background on them so that they feel like this person really knows about who they are. And that's what we want to teach, is that the people that are in front of us as patients, treat them like family. If you treat them like family, treat them the way you want to be treated, treat them the way you want your wife, your child to be treated. That's the way healthcare should be in America. And if we do that, then this becomes a home. It becomes somewhere where people can feel comfortable with whatever problems they have, from a hangnail to cancer, can come in and talk to us. We can navigate their healthcare, do what we need to try to help them navigate whatever is a concern for them at that day.
Well, and that comfort level that they know they can come to you with whatever the issue might be. And by that comfort level, they get diagnosed or their issue gets addressed a lot earlier, which helps down the line in terms of them being able to head off serious problems or at least find out about an issue early.
Yeah, it really does. And that's so important. There's so much fear around healthcare in so many aspects. And I know I've had patients in the past that would say, they'd come in with an advanced disease and you would ask, well, why didn't you come in earlier? And they said, well, I was afraid to come in because when grandma came in, next thing I know, she got really sick. Mm-hmm. But the reason we had to explain, it wasn't because she came in, it was that she hadn't had that preventative care that was needed. Mm-hmm. And so what we're trying to do is train and educate our patients that this preventative care that we talk about every time they're in the office is so important to their longevity and their quality of life. And so that if something does come up, they feel comfortable about coming in and we can talk about that.
So if a patient or individual that's watching this doesn't have a primary care physician or a family medicine physician, how do they establish with the Family Health Center?
It's really easy. There's 2 or 3 different ways you obviously can do it the old-fashioned way, pick up a telephone and make the phone call here to the office, and we'll be glad to do that. There are also some ways through the internet. There's a ZocDoc, which you can Google ZocDoc and Winter Haven Family Medicine Residency and the health center here, and it'll come up and it'll show all the physicians. If you know a physician's name, you can Google them. It'll come up and give you their telephone number, and you call and you go straight into the appointment line. So that's the easiest way, seems to be now. Or you can always come and just stop by if you want to. You're always welcome to do that. Just come in and say, I'd like to make an appointment.
Very good. So, June is Men's Health Awareness Month. And what are some of the most common men's health concerns that you address?
Yeah, the probably the two or three that are most common, and the two or three that we see just pretty much anywhere you are. Number one is heart disease. Heart disease is the number one killer of men, and one of the risk factors of having heart disease is being a man. You have a higher risk of heart disease than women of your same age. So it is so prevalent that I think the CDC tells us that there's over 600,000 deaths from just heart disease in males every year. So I think it comes out to be 1 in 4 deaths from heart disease. And heart attacks are part of that heart disease. So we have over I think it's almost 800,000 heart attacks a year just because of heart disease. So if there's one thing, number one is probably heart disease. And that's been shown across the country that with our American diet and our habits, that seems to be our number one health problem and concern these days.
And so, you kind of explained who is most at risk
Right.
for heart disease. Are there any other risk factors that people should be aware of?
Very much are some risk factors. Number one is genetics. If your mother, your father, brother, sisters have heart disease, you have a much higher risk of having heart disease. That's number one. Number two is just our lifestyle. Sometimes blood pressure issues. Blood pressure is a heart disease risk. Keeping it under control. We want that blood pressure below 140/90, preferably around 130/80, 120/80. But keeping that blood pressure under control, having it there lowers your risk of heart disease. Lowering cholesterol, keeping your cholesterol controlled, whether it's by diet and exercise or doing it with some medicines to help aid that would lower your risk also. One of the easiest modifiers to decrease your risk of heart disease is stop smoking. Smoking is the number one risk factor. So if you can stop smoking, that decreases your risk enormously. The other couple of things are if you have diabetes, it's an independent risk factor for heart disease. So keeping diabetics, there's glucose controlled, keeping your glucose, that hemoglobin A1C we talk about around 7, reduces your risk. And then the last thing is that we don't talk about it a lot, but alcohol can exacerbate or make heart disease worse. Doesn't mean you have to stop drinking, but binge drinking, over drinking, drinking more than 4 drinks a night, a day will increase your risk of heart disease. So you want to drink moderately, 1 to 2 drinks, preferably not every night, but 1 to 2 drinks at the most. So if you can control those things, which basically your blood pressure, your cholesterol, stop smoking if you are smoking, control your diabetes, and then drink in moderation, that will be able to decrease your risk of a heart attack. And maybe you won't be one of those 800,000 that have a heart attack every year.
And you mentioned diabetes, and I've also heard that mentioned as a common men's health concern as well. What do you see in that arena?
Yeah, diabetes is a very high risk. It affects so many parts of the body. As we all know, diabetes is the body's inability to deal with the sugar that you eat, the carbohydrates that you eat, and it's a disease where you don't have enough insulin. Insulin is a hormone that's put out by the body that goes out and actually grabs the sugar, the glucose that's in your bloodstream, and then puts it into the cells in your body. And it puts it into every cell. So if you don't have enough insulin, what happens is that there's too much sugar running around in your veins. So your blood sugar is too high. So when that becomes too high, it begins to affect your eyes and any organ that has small blood vessels that could be damaged because of the sugar that's in the blood. So your eyes, your kidneys, your veins, so you get the neuropathy. So controlling diabetes is extremely high. Then also, like we talked about the heart, it damages the vessels around the heart, causing plaques to form and increases your risk of heart disease. So yeah, diabetes, controlling that. Studies have found that if you control your diabetes, keep that hemoglobin A1C number under 7, which means that your blood sugars are running about 150 average, that you'll have a normal lifespan. But anything above that tends to cause damage to other parts of the body, which could decrease your lifespan, decrease your quality of life. So yeah, diabetes, it's such an invasive disease. So many people in America have it, and we can develop it just because of diet sometimes. It's inherited a lot of the times. Type 2 diabetes is inherited if your brother, mother, sister, just like heart disease, you have an increased risk of getting it. But also you can get it if you just don't take care of yourself. You can become what's called insulin resistant. And so the insulin you do put out doesn't work the way it's supposed to. So those kinds of factors, if we can come in and discuss with you and team with you to change lifestyles where you change your diet, increase exercise, decrease your weight. Many times we can control diabetes with just diet and then just make your life just normal, a normal lifespan without any kind of consequences from the disease itself.
And then going directly back to the importance of having that established medical home and preventative care to have those discussions about that.
It is. That's exactly right. And that's what it does aid with being a partner with a physician and with a health center, so that you can come in and we can check to make sure your medicines are doing what they're supposed to be doing, that your blood sugars are remaining right where we want you to be. And it's one of those that as a team, we can go much farther than as you can by yourself. Yes.
And one of the third, common ailments that we hear discussed when it comes to men's health, really anyone's health, but since it's Men's Health Awareness Month, is cancer. So talk a little bit about, from a family medicine perspective, the importance of that relationship with your patient when it comes to cancer.
Yeah, and for men, I'm going to talk about the big three probably. The first one is lung cancer, and the second one is colorectal cancer, and the third is prostate cancer for men. So if we were women, we'd be talking about breast cancer, which men do have some breast cancer, but it just doesn't have quite the prevalence that women do. So lung cancer is by far the most common cancer in the United States. It's the most common cancer that kills any individual in the United States. And the number one risk factor for lung cancer is
Smoking.
tobacco. Yeah, smoking, right? All together now. Tobacco. Yeah. One of the jokes when you're going through medical school and they're giving you take tests forever and ever and ever and ever. But always if they're asking about tobacco, it's always bad. So if you can answer it, you'll get the question right.
It's like always filling in C, always just put tobacco.
That's it exactly. So yeah, the number one risk factor for lung cancer is tobacco, and it's obvious because the smoke gets in there, the chemicals get into your lungs and modify the genetics that are in there and can cause cancer. So one of the first thing we do is screen for tobacco, and there are some screening things. Even if you have smoke, doesn't mean that you're going to get cancer. And the national organizations have set up some screening guidelines, like the American Cancer Society and some other organizations, that even though you've smoked, we still want to screen you. We will do what's called a CT scan and look at your lungs. If you've smoked over 20 years, 20 pack years, which is 1 pack a day for 20 years, if you smoked over 15 years or within the last 15 years, that many cigarettes, then what we do is we just take a real quick CT scan, look at your lungs to see if there's anything in there that's suspicious. And then that tells us sometimes we can catch cancers if they are there very early. We can deal with them in lots of ways, whether it's from surgery or radiation. And sometimes it's just monitoring them, and they just remain there and don't have to do anything, depending on what we find, if we find some nodules. So that's number one is lung cancer. The second is colorectal cancer, which we all probably have been touched by colorectal cancer somewhere in our family. Someone we know has had some kind of colon cancer along the way. And there are new ways, actually, not with colonoscopies, for those who still don't want to do colonoscopies. There is a DNA test called Cologuard that you've probably seen advertised on TV, that they send it to you in the mail, send it FedEx, and then you send it back to them and they check for DNA to look to see if you have some blood or DNA, cancer DNA in the sample. And if it is, then we have to look further. But a lot of times it's negative, so you're good for about 3 years. There are some other tests that we can do every year, which we just do, and they're rather non-invasive, but we check those every year to see if there's any warning signs of cancer. But it's one of those that we really push because it is so important and it's so life-changing. Lung cancer is life-changing too, but colon cancer, we have so many good medicines now that treat colon cancer, that people that come out, they come out doing well, but sometimes we have to take some of their colon out because of that. But if we can find it early, detect it early, maybe we can extend lives, maybe we can make lives better because of that. So colon cancer is another one.
If you don't have a family history of colon cancer, is there a certain age that you should start to be talking to your physician about getting colonoscopies?
Yes, at 50 years old, if you've not had any family history, if your mother, father, first degree relative, brother, sister have not had cancer in the past, then at age 50, we start doing cancer colon screenings. And that's when we start talking about which would be the best for you. If you're low risk, maybe one of the Cologuards, which is once every 3 years, or the once every 1 year test, which is called a FIT or a FOBT test, might be best for you. If you have a little bit higher risk, colonoscopy might be the best way. But yeah, starting at age 50 and then going until age 75 is when we would screen for colon cancers.
And then you mentioned prostate cancer as well. So what should a gentleman be looking at when it comes to prostate cancer?
Yeah, and this is something that all men worry about now. It's become much more known, and we all know someone that's had prostate cancer in the past, whether it's in our family or not. Same thing goes with it as with lung cancer and with colon cancer. Family history is the number one risk factor for it. And prostate cancer and the symptoms that go along with it are a little different than some of the other diseases. All men have a prostate gland, and at age 50, that gland begins to increase in size. Not necessarily because there's cancer there, just because of a normal process of aging. And so just because you might have symptoms of prostate cancer doesn't mean that you have prostate cancer. And we've all heard this other term called benign prostate hyperplasia, which just means that the prostate has gotten a little larger. So when you're screening for prostate cancer, there's not a good screen for it. We use a blood test called PSA, which is prostate specific antigen, is what this stands for, PSA. And we look at that, but it's not very specific for cancer in and of itself, but it gives us an indication of whether we should look farther. But one of the biggest way that we screen for prostate cancer is we ask for symptoms. Does a man have difficulty beginning urination, getting started? Does he have trouble when he's urinating? Does it stop all of a sudden and then he has to start again? Does he have pain with urination? Does he have blood in his urine? Those types of symptoms, that may indicate that we need to look a little bit farther and see whether it's just the normal enlargement of the prostate gland or whether there might be cancer there. So with prostate cancer, it's just mostly questions unless we have some kind of warning signs. And then if we have warning signs, then we look a little farther with an exam. We might do an MRI to look to see if we see anything in the prostate gland itself.
Well, Dr. Atkins, you have given us a lot of information today, and it was very unfortunate for the coal industry that you left, but it's to our benefit that you went into the medical industry, and certainly that you were recruited into the Winter Haven community. What you've underscored today is just so important, whether you're male, female, grandmother, child, the importance of establishing with a medical home such as the Family Health Center is just so important to the future health of our entire community. So I want to thank you so much for taking the time to have this discussion today.
Thank you. It's been a pleasure. It's been a pleasure to do this. And thank you so much for the time.